This morning we continue our four-part series on improving health care for you and your family with the help of your pharmacist. It's part 2 in our series, and today we're talking about heart health and COPD. And here to explain is Dr. Marcia Mallett from Good Neighbor Pharmacy, a network of more than 3,000 locally owned community pharmacies. Welcome, Marcia.
Thank you.
First
Thank
of
you for
all,
having
you're
me.
stunning. And who wouldn't want you as their pharmacist?
Thank you. Thank you so much.
Marcia, remind me what you do at Good Neighbor Pharmacy.
Well, Julie, I'm not just a pharmacist. I am a pharmacist that likes to talk to our patients. I consult with them. We're community driven. We do a lot of community activities with the patient. Our patients know us by name, and they can come and talk to us about anything.
Your pharmacist is so important. You see them more than your doctor, so I love what you're doing there, and I'm sure you do treat a lot of patients who have heart disease, and how are you able to help in that area?
One of the things I want to point out is that heart disease is the leading cause of deaths here in America amongst women and men. And let me add that according to the World Health Organization, as recent as 2012, there were 17.5 million deaths that were attributed to heart disease, which represented about 31%. And now that's globally. Those numbers are pretty staggering.
Yes, they are.
So what we want to point out are the risk factors for heart disease. You have smoking, high blood cholesterol, high blood pressure. There's obesity, overweight, physical inactivity, and diabetes. Many of our patients, they come in presenting with those risk factors, and we get an opportunity to educate and talk to them about their disease state and talk to them about their medications and make certain that they're taking their medications like they're supposed to.
Yeah.
And if there are any issues there, we have the opportunity and the time to contact their physician. So it's always a collaborative effort with the patients.
What I love about Good Neighbor is that you aren't behind this wall. You're right there, you're accessible, and you can deal with your patients and their issues.
Absolutely, yes. You know, we're upfront and personal. You know, I say it's like an old-fashioned type of feel. We know them by name, we get to know their families, because we see them more often than not than their physicians. And in dealing with their smoking issues, number one, you know, I talk to my patients about, okay, are you ready to quit? Because you have to first make the commitment that you want to quit, that you want to stop. And then I offer information such as support groups, and then there are medications that are available to assist them. One of the leading causes of COPD is smoking. And that goes hand in hand, because remember, one of the risk factors for heart disease is smoking. Many times you have patients that have more than one condition. So it's very important that we're there to take the time and talk to the patient and make certain that they understand their conditions. Because sometimes they come in, they take medication, and they ask me, okay, Dr. Mallett, what am I taking this for? What is this medication for?
Right.
You know, and then I have to point out to them, okay, your doctor prescribed this medication because you have heart disease or because you have high blood pressure. I also say to them, but you know, you have to make certain that you know the name of your medication, because they'll come in and they'll say, okay, well, I know I got this pink pill or this green pill. And I say, no, no, no. It's very important that you know and understand the name of your medication, because God forbid that there's an emergency and the person that's taking care of you, they must know exactly what you're taking. So yes, we do like going out front and coming from behind the counter and having that interaction with our patients, because we're very much community driven. That's what we do. You know, we have patients who are diabetic. We have patients with high blood pressure. We have patients with high cholesterol. We have patients who have HIV and who have cancer. And we're taught to look at the patient and their presentation and be able to counsel them to help better their issues.
Marsha, thank you so much for coming by. Great information.
Thank you for having me.
All right, if you want to know more, log on to thebalancingact.com. You can also follow us on Facebook and Twitter.